Hi, my name is Andy Wolff. This is my video on arthroscopic labral reconstruction of the hip. This is performed when the labrum is irreparably damaged or has retorn and is poor quality tissue. The video I will show today is that of a 38-year-old woman who is a triathlete who underwent a failed labral repair and was referred to me for continued pain. Inside the hip, we see a significant amount of scar tissue and essentially a non-functional labrum, which is of poor quality tissue. It is likely this tissue plus the uncorrected impingement, which is the source of her pain. We'll therefore remove this labral tissue along the acetabular rim and then correct her residual impingement. This is the pincer type impingement, which I am correcting with a burr. I then will measure the defect of the labrum on the acetabulum with this measuring device. Once the defect has been measured, I will then place suture anchors into the acetabular rim. These are drilled and then malleted into place. They are anchors which have sutures attached to them. The anchors are attached into the bone. In this case, I've placed 6 anchors along the acetabular rim. Once the anchors are placed, I will then turn my attention to forming the graft. I've measured the length of the graft and then I will reinforce it with suture running the length of the graft. I'll then cut the graft to the appropriate length and then introduce the graft into the hip joint down the suture from the anteriormost anchor. This suture is then tied, and then the sutures which were from the anchors which were previously placed are now passed around the graft and retrieved through the cannula and tied. Once the sutures are tied, a suture cutter is then introduced and the sutures are cut with small tails. Once all the anchors have been placed, the sutures passed around the graft is tested for security by probing it with a metal probe. I then will remove the traction from the hip and take the hip through range of motion to ensure that there is a good suction seal provided by the labral graft on the femoral head, as well as to ensure that there is no impingement throughout the range of motion. Thank you for watching my video on labral reconstruction. For more information, please see my website, www.andrewwolffmd.com.